Hello again, this is Dr. Kaur again, hypertension specialist here with a video on how to check blood pressure at home. Um, it is more so the basics that I go over with my patients in the clinic. It would be a very basic video because this is one of the first one in the series. So here we go. Okay, so let's say that I don't have a blood pressure cuff with me today. So let's say that I want to check my blood pressure and you want to check your blood pressure. So the first thing is you have to have a bare arm, right? Either the right or the left arm. Ideally, once in a while, you should be checking your blood pressure in both the arms. So you know that it is within a few points of each other. There is not a huge difference between the two arms. So let's say that I want to check the blood pressure. A few things you need to remember. When to check blood pressure. So there is no time that is not right or in a day, but there are a few things that you want to realize. The blood pressure needs to be checked when you feel you are peaceful, you are at calm. Kids are not shouting in the house, you are not having an argument, you just didn't rush down or you didn't rush up a flight of stairs and you just didn't work out in the yard. So it is a time when, yes, people like to check it in the mornings and then they like to keep a log of their blood pressures. At a certain time in the morning, they wake up either before their medications or after their medications. It is fine. As long as you have your blood pressure written with the time. So let's say I am keeping a log and I write down the days and the times, okay? So let's say this is my log that I'm going to keep and I would write down, let's say today is June 19th. Then we would say the blood pressure is whatever the reading is. We could write it, blood pressure, the top number and the bottom number. And then here I would also make a column of the time of the day, okay? So let's say I get up and it's about 7:30 a.m. I brush my teeth and then before having my morning coffee or tea, I want to check my blood pressure. So the first thing that you need to realize is you are not anxious, you are at rest, and you have to check your blood pressure in a chair. That would be the best thing to do. It could be a dining chair, it could be a desk chair like the chair I am sitting on right now, and your back needs to be flushed with the back of the chair. Okay, your feet are on the ground. I don't know if you can. So the feet are on the ground. I'm not crossing my feet. The feet are on the ground like that. The blood pressure cuff needs to be at the level of your heart. So if I'm putting my arm here, I'm going to put my cuff as is on the instruction pad. They'll tell you exactly where to put the cuff. You put the cuff, slide back, you are relaxing, you check a reading. Let's say this reading is high. It reads 150/90, and you think this is high for you. Discard that reading. Wait a couple of minutes, relax, the same way, check your blood pressure again. If this reading is better, let's say it's 130/80. Write that down. Also, another thing that you want to be sure about is you don't have urine in your bladder, like you have peed, because if you are holding your urine and you are trying to check your blood pressures, it is going to be high. It could be high. So those are the basic things that you can check your blood pressure at any time of the day. Write it down with the time of the day that you have checked it with. Yes, the blood pressure medications have effects if you have taken your blood pressure pill and it is a short-acting medicine, typically a medicine that you could be taking a few times a day. That is going to impact your blood pressures. But usually the blood pressure pills that are 24 hours pills that you take once a day, they are supposed to last a long time. In one of these talks, we will go over the medications which have a long-term action. Most of us are on a water pill, a diuretic, like the hydrochlorothiazide or the chlorthalidone, torsemide. These are common water pills that we use for the high blood pressure, and some of them have a longer action than the other ones, and we will talk about those. But primarily, blood pressure check any time of the day. Sit in a chair and check it. Don't check it in a recliner. Don't check it in bed. to tell you that my father, who is my father, and he should know how to check his blood pressures, he just forgets it. My mom would help him check the blood pressure and he would be in the bed and check it. Just remember, the blood pressure needs to be checked in a chair with your back flushed to the back of the chair, your arm and the blood pressure cuff. Place your arm on the dining table or on a desk, and then put the cuff on, check it. If the blood pressure reading is high, discard it. Check it again. If this one is lower, write the lower reading down. And then you may check it again. Some of my patients are in a habit of checking blood pressure way too frequently, that they are impacted by the whole process of checking the blood pressure. I would say don't do that. But yes, sometimes it helps. It helps us. It helps me if my patients would check blood pressure at different times of the days. So then I know which pill is helping them better. It helps us as physicians to change the pills around, whether they should be taking the medications in the morning or at night, which one should go in when. So yeah, those are the things that I want you to be careful about, and take care. We will control high blood pressure together. Bye for now.